Hi, my name is Siddhartha Milkuri, and today I will be going over my research on glaucoma detection and progression monitoring via a machine learning retinal image analysis. So yeah, my name is Siddhartha. I go by Sid. I'm a rising senior at Bentonville High School, and that is located in Bentonville, Arkansas, within the United States of America. Some of my interests include scientific research in AI, particularly AI applications in medicine. I've participated in international science fairs such as ISEF and JSHS. I'm also heavily involved in my community, raising money for the Leukemia and Lymphoma Society Visionaries of the Year campaign. I also founded a nonprofit known as Simply STEM, in which we democratize STEM education by making it as accessible as possible. And finally, I'm also the president of the Indian Student Association, where I lead in the creation of cultural Indian events. I've also been playing tennis since I was 9 and still play, and I'm on the high school team. So, a brief overview of this presentation. First, I'll be going over global health, what it is, why it's relevant. Then I'll talk about some background to the global health crisis I will discuss today, which is glaucoma. Then I'll talk about my research/solution to this global health crisis. Finally, I'll talk about the significance of this work and some future features I could add to this project. So, what is global health and why is it relevant? Global health is the area of study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. Essentially, what this means is that everyone deserves equal access to quality healthcare, no matter their geographic location. This is fueled behind the motivation of everyone deserves a healthy future. So, the global health crisis I will tackle today is glaucoma. Glaucoma is an eye disease that causes damage to the optic nerve, severing the link between the eye and the brain, leading to vision loss and eventual blindness. This is very apparent as glaucoma is the second leading cause of blindness globally, with over 70 million people having some sort of glaucoma-induced vision loss. These individuals have also reported having increased anxiety levels, increase in difficulty in daily tasks, and some have even succumbed to depression, showing that this is a global health crisis. However, if glaucoma is detected early and then treated properly, any glaucoma-induced vision loss can be completely prevented. However, this is not the case due to issues with the current screening process of glaucoma. That being a high cost in which the average eye appointment in the United States is $150, and many simply can't afford this. Low accessibility, especially in developing nations, as these countries don't have access to the expensive screening equipment or medical personnel that are required to give proper glaucoma care. And finally, glaucoma is also prone to high inaccuracies, as a glaucomatous eye looks very similar to a normal eye in its early stages. So that brings me to my research, which acts as a solution to this global health crisis, in which I implement a machine learning retinal image analysis for glaucoma detection and progression monitoring, the latter of which is a very highly overlooked aspect of glaucoma care. The goal of my research is to break down any barriers currently preventing people from acquiring quality glaucoma care. And to do this, I need to make my system inexpensive, accessible, and highly accurate. How the system works is a retinal fundus image or retinal image is captured using a smartphone attachment paired with a smartphone. Then this retinal fundus image is uploaded to the mobile application, which houses the machine learning software. The first machine learning software to analyze this retinal fundus image is the optic disc segmentation model, which localizes and segments out the optic disc region of a given retinal fundus image. This segmented retinal fundus image is then categorized as being positive or negative for glaucoma. If it is positive, it's sent to the progression categorization model, where it's categorized as being in a state of worsening or stabilizing for glaucoma. If it's in a state of worsening, that indicates, hey, the treatment likely needs to be changed. It's not working. So how the smartphone attachment works is that it's connected to the back of a smartphone, and with the flashlight turned on, you can look within a human eye and capture a cheap image of the retina compared to traditional equipment, which can cost up to $20,000. This image of the retina is then uploaded to mobile application, where it's analyzed by the following machine learning models. The first of which is the optic disc segmentation model. This is done to reduce the computational load on subsequent models, increasing the overall accuracy of the system for glaucoma detection and progression monitoring. My optic disc segmentation model had an intersection over union score or overlap score of 95%, which was high enough for the model to predict the correct optic disc region of a given retinal fundus image correctly every single time. This segmented retinal fundus image is then sent to the glaucoma detection model, which was trained on over 11,000 retinal fundus images to make it as highly generalizable and actually usable in real-world use cases as possible. the accuracy of this glaucoma detection model was a stellar 98.68%. If the segmented retinal fundus image is deemed positive, it is then sent to the glaucoma progression categorization model. Glaucoma progression categorization based off only retinal fundus images using machine learning has never been done before. And I was able to do this using Google's Inception V3 architecture, and the model had a stellar accuracy of 95.88%, showing that glaucoma progression categorization using machine learning with only retinal fundus images is possible. Now let's look into some significance of this project and some future work I can add on as well. So GlaucoScreen is a highly accurate diagnosis system for glaucoma, being on average 10% more accurate than even trained ophthalmologists, solving the issue of inaccuracy. GlaucoScreen is also very effective at monitoring the progression of glaucoma, which is crucial in preventing any glaucoma-related vision loss. This is a very novel aspect of the project. It also works to make quality glaucoma care accessible even in developing countries by removing the need for trained personnel because of its machine learning based nature and ridding the need of expensive screening equipment with the smartphone attachment, solving the issue of inaccessibility. And finally, through GlaucoScreen, a preventable blindness caused by glaucoma will be a thing of the past, as all barriers previously blocking quality glaucoma care are now removed. Even though I'm very happy with the results I've garnered, I know there's a lot I can add to this project. The first of being tabular data such as age and sex being inputted into the model as well, making the glaucoma detection and progression categorization more personalized and more accurate. I also want to expand the GlaucoScreen system to include more eye diseases such as diabetic retinopathy in hopes of creating a blindness-free world. And finally, I'm currently working on a chatbot that suggests treatments based off the results of the progression categorization model. These are my references, and thank you. Feel free to reach out to me if you have any questions, and I want to thank the GHLC at JHU for giving me this opportunity to present my research.